Bonjour, Kenneth. Comment est? It's really good to see you. And I know there's been a lot going on in Haiti, and I know that the clinic has been doing a phenomenal job serving the people in St. Roch. So, how are things with you? And how have you been able to continue to provide the quality services that you've been providing to that population?
I'm happy to see you, Alex, and thank you for the question. It has been very challenging last year because we lost a president. We had the earthquake in the south, the kidnapping in Haiti. For example, a father in the Saint community, maybe you know him by the news, Father Michel, was kidnapped for more than 15 days. Because of the insecurity, her journey has been changed. Before was like 20 minutes to get to the clinic, and now we have to pass like more than 1 hour. In front of those problems, we continued with the same heart to deliver the same care to our community and others.
Kenneth, as you just mentioned, the difficulty, the challenges, how do your staff, how's your colleagues doing? How have they been able to come to work every day and to continue to provide the services that they're providing? Just how are things, how are they doing? What's the disposition right now, giving all just the craziness? And I know you're right in the middle of it, and they are too. So how are they doing?
That's a very good question. Like any other staff in Haiti, we are stressful because we never know what could happen in any time. We can divide a staff by two groups. There is like the same work group staff. They are there like 24 hours by 7. People in the community sometimes go to receive some care in their house. And we have like the staff who lives far away or outside the Saint, and I am one of them. The Saint car pick up us like every day at Pétionville and bring us in the to the clinic. We formed together a good staff with a passion. We try to listen each patient and provide a good quality of care, of service.
Haiti's been going through so many challenges, particularly there's been assassination of the president. And right after that, there was this devastating earthquake in the south. And I know you've been working with them, you've been providing support to the families in the south. How's that been going?
I am proud of my staff, proud of my colleagues in the US. The staff, like the satisfaction of a beneficiary, is for each of Saint Work Haiti Foundation members, is for everyone who contributed or participated to make the response happen after the earthquake in the south.
Kenneth, it's hard to believe it's been 11 years since you start working in the clinic in St. Roch. What has been your greatest achievement in this past 11 years? What are you most proud about? And, and what do you feel as the most challenging? What are the needs? And sometimes people think of Haiti as just an insecurity, and it's not. We've been talking about pockets of hope. And we do feel that St. Roch is one of those pockets of hope in the midst of chaos. But, it's been 11 years. How do you feel about your achievement, the achievement of the clinic?
I have 11 years working like a medical director. Before that, I worked as a physician for 3 years. Right now, I have 14 years in Saint Roch. I can start by the employees. We started with 3 employees. Now we have like a 51. Now we have two clinics, one in Saint Mark, one in Macaco, and one place at Saint Michel where to do like a mobile clinic. We have more than 20 graduate students and 78 students now in the university. We just left an individual scholarship program to a global program that permit more kids to go to school. Before that program, less than 100 kids have access to the school, and now we have more than 500 kids in 5 schools. We have a poultry program that permit 2 more jobs in the community. At the end, we have a garden. This year we project to use more than 1 hectare. I think it's amazing. 1 hectare, like a garden with corn, vegetables, and other things.
Again, it's been 11 years gone by so fast. What do you see as the greatest needs of the clinic right now? If you were to ask us for a few things, what would you ask for? What do you see as really the needs? What would make you do your work better?
I can respond you, Alex, with that example. We are seeing like 1,500 pregnant women last year. And some of them deliver at home, and I can say we lost few of them. I could say one of the more important things now is maternity for the community. We can talk about like mental health care too, but the principal need for now is the maternity.
It's been a pleasure. I know that at the Kellogg Foundation, we put really a value on organizations that are providing quality access to maternal and child health. And sometimes our partnership is not just around the funding that we do. It is also the alliances, the connections, the thought leadership or the thought partnership we could have with organizations. And it's not always easy, but this is something that we totally value. And we know that to really address the issue of maternal and child health, it has to be a regional approach. For example, there is unlimited demands, and not one organization can fulfill all of those demands. So our approach to maternal and child health is regional. There has to be a network of organizations so that every woman, expected mother, don't have to go to the same place. There has to be choices and options in the communities where people live so that they don't have to travel long distances to access quality care, particularly in a time when many families are just unable to travel freely around the country, as is the case right now in Martissant, which is the way through St. Roch. So the kind of partnership, and we really encourage this kind of strategic alliances where organizations and funders could work together to make sure that we are supporting what some of our partners are calling pockets of hope. And we do see St. Roch as one of those pockets of hope where amidst all that's going on in the country, people can access quality services. And it's important to make sure that, yes, the women, the children can access the services. So we're very happy to be in communication and be a partner with the St. Roch Haiti Foundation.
As chair of the board for the St. Roch Haiti Foundation, it is my pleasure to be here celebrating the 20th anniversary of this incredible organization and to once again present the Stephen Bresnahan Award. Steve and I met back in 1981. We trained in medicine together. He was a very dear friend who introduced me to the life-changing work of this foundation. In 2013, we traveled to Haiti together, a trip that literally changed my life. I continue to be inspired by his legacy. The Bresnahan Award is presented annually to an individual or individuals who work tirelessly on behalf of those struggling to make a better life for themselves, their families, and their communities. It is my honor to bestow this award to Brian Concannon and his colleagues at the Institute for Justice and Democracy in Haiti and their Haitian-based sister organization, BAI. Together, they are leading the charge as advocates for human rights in Haiti and just treatment of Haiti by the international community. Congratulations to you all, and thank you for your continued effort on behalf of the Haitian people.
For those of you who don't know me, my name is Brian Concannon. I am a human rights lawyer and the executive director of the Institute for Justice and Democracy in Haiti, or IJDH. I started my legal career with a large Boston law firm, but felt called to put my energy and skills to work full-time for people who really needed it. I first went to Haiti as a UN volunteer in 1995. I expected to stay a year or two. I stayed for 9 years, mostly working with the Bureau des Avocats Internationaux, or BAI, which is now Haiti's largest and oldest public interest law firm. In our work at IJDH, we try to make systems function for Haitians, so we often think in terms of systemic harm. Tens of thousands of people killed by cholera, hundreds of thousands of school-age kids unable to attend school. But underneath those big numbers are real individuals and families. Someone's mother dying of treatable, preventable disease, someone's child not given the chance to learn themselves out of poverty. Systems change takes time, and in the meantime, Haitians continue to suffer. So it is a great comfort to know the St. Roch Haiti Foundation is treating and educating people who need it every day, keeping them out of the statistics of unacceptable suffering. Over the past 6 years, I've had the chance to meet with Jaceml and other St. Roch Haiti Foundation leaders to discuss their work and to enjoy the gracious hospitality of this gala. I've been impressed by the Foundation's bottom line, the increasing amount of people the clinic and school have been able to help. But I've been even more impressed by the way St. Roch has done it, especially its developing and empowering the Haitian staff and ensuring that the health and education work fits within the broader health and educational ecosystems in Haiti. That work requires investments of time and thoughtfulness. It does not produce immediate increases in the amount of people helped, but it does provide the Haitian-led capacity that is essential for sustainable change in Haiti. The importance of this capacity building work has been demonstrated over the past few years. As crime and civil unrest in Haiti has mounted, as fewer people from Boston and the rest of the U.S. have been able to visit the country safely, the St. Roch programs have not been cut back by the challenges. Instead, the Haitian staff have increased services to meet the increased needs. It is a great honor to receive recognition in Dr. Stephen Bresnahan's name. I did not have the privilege of knowing Steve well, but did meet with him a few times. In those meetings, he never took over the room or dominated the conversation. Instead, he carefully and respectfully listened to what others said, then asked thoughtful questions. When he did add his 2 cents, he invariably had something thoughtful and insightful to say. I remember Steve talking about his work building the capacity of the Haitian staff at St. Roch and participating in the work in Haiti in a culturally sensitive, respectful way. The conversation was memorable because Steve talked honestly about how hard it was, despite all his training and accomplishments in the U.S., to navigate effectively in a context so far removed from his own training and experience. Steve did not speak with pride on what he had done, even though that was impressive. Instead, he spoke with modesty of his own limitations to doing more. Steve and I share an alma mater, Boston College High School. We were taught there to follow the Jesuit ideals of living compassionately in service of others and to use our privilege to help create a more just and inclusive world. I have tried to follow those lessons, perhaps because it was easier than following the school's chemistry lessons. Steve did the chemistry well enough to be a physician. He also did the part of putting his privilege at the service of others in both his day job of serving general practice patients in Brockton and his other job helping build the St. Roch Haiti Foundation into what it is today. The world would be a better place with more people like Steve in it. It is a lesser place without him, but we can and we will use his inspiration to do work he would be proud of. Thank you.
My story begins with a 30-year-old woman who has 3 small children that she can't house, she can't feed, she can't clothe, and she can't educate, and she finds herself pregnant again. She miscarries. And this is where our clinic comes into play. She bleeds for a week and needs to be seen at a clinic. and the village told her that our clinic was the place to go. So she got up very early and walked in the mountains.
I was just struck the first time I went, especially by how many people were waiting outside in the morning to be able to get medical care, and how much effort they had to go through just to get to the clinic and see a doctor, see a nurse. I noticed this woman kind of curled up, and she obviously was very sick. And I noticed that she was bleeding pretty heavily as well. So I went and got help.
And they notice her because she can barely sit up. They immediately take her into what they call as the emergency room, is a room that has no electricity, cinder block walls, a small window, has a code cart, a hospital bed, some IV poles, and an examining table. And they call Dr. Kennis. They get her on the examining table, and he examines her. And he diagnoses her with retained placenta. Dr. Kennis starts an IV, and he asks me to mix a smaller IV bag with Pitocin. Pitocin's a drug used to induce contractions. And his hope was that this would push out the retained placenta and then halt the bleeding. That did not work. She needed an operation. We were the only place she could turn to. She knew she was in trouble. As I said earlier, her village told her this was the place to go. But she was so grateful. She was so kind, she was so strong, she was so stoic, and never asked for anything.
When I was in St. Roch, I was very interested in seeing what the doctors and nurses there were doing and the level of care they were able to provide. But I don't think I fully understood how impactful the foundation was, or how big of a difference the clinic was making, until I saw this specific patient interaction. And, you know, it was a very intense situation for an 18-year-old to be observing, and I think it reaffirmed for me that I wanted to work in healthcare.
Fast forward, it's now 7 p.m. The clinic had been closed for 2 hours, but the staff never left. The director of operations never left. They stayed for Velma and to help Dr. Kennis. The emergency room had no electricity, and so Roch went outside, turned on the truck headlights, turned the truck around, and so the lights on the headlights of the truck were shining through the high window in the room she was in, and it sort of gave a moonlit glow, which was perfect. She seemed okay, and we transferred her to the chair, Jaceml and I. I looked up, and she was gone. She'd completely passed out. I yelled, and the nurses were right there. Kennis was right there. We got her back in to the bed. What seemed like an hour was just, I'm sure, a couple of minutes, and she ended up coming to. And she seemed okay. Neurologically, she was still alert and proper. Kennis, the nurses, and ourselves all packed her up quickly, carried her out to the truck, and they drove her down the mountain to a hospital to get help. She did survive, but she wouldn't have survived if it wasn't for the help and the donors and the sponsorships of the clinic. We couldn't have done this without all your support, and she wouldn't have survived, and she would have left 3 young children without a mother. So let's not let this happen again. Let's do the right thing, and let's raise our paddles and have a bigger and a better St. Roch.